Let's be honest, dealing with a hand injury is just plain stressful, not to mention painful. If you're here because you're worried you might have a broken hand, you're in exactly the right place. We're going to walk through what that means and what your path to healing really looks like, all based on trusted medical guidance. So, you've hurt your hand, and the big question looming is, now what? I know that uncertainty can be the absolute worst part, but don't worry. Think of this as your roadmap. We're going to go step by step, from figuring out what's wrong all the way to getting you back to your normal life.
Okay, first things first, what is a hand fracture? Well, it's pretty simple. It's a break in any of the small bones in your hand. That could be the metacarpals, those are the bones that make up your palm, or the phalanges, which are your finger bones. And these are super common injuries, usually from a fall, something at sports, or really any kind of direct hit.
Now, for the question that's probably on your mind right now, is my hand actually broken? It can be really tough to tell the difference between a fracture and just a bad sprain based on pain alone. So, let's break down the specific things to look for. This is a really key distinction to get, the difference between symptoms and signs. Symptoms are everything that you feel, the constant pain, the throbbing, that sharp jab of pain when you even think about grabbing something. Signs, on the other hand, are what a doctor actually finds when they examine you. Things like a visible deformity, or maybe your fingers don't line up right when you try to make a fist. This difference is exactly why getting a professional diagnosis is so important.
While pretty much any potential fracture needs a doctor's visit, some situations are definitely more urgent than others. So how do you know when you need to stop what you're doing and get immediate care? Okay, these are the critical red flags. Pay close attention here. If you've got numbness or tingling, that could mean a nerve is involved. If your fingers look pale or feel cool to the touch, that could be a circulation problem. And if your hand is severely out of shape, or, and this is a big one, if there's an open wound over the injury, that's what's called an open fracture. Any of these mean you need to get to urgent care right away. So you've done the right thing and you're at the doctor's office. What happens next? Well, this is the part where they get down to business, confirming the diagnosis and figuring out the exact details of your injury.
The number one tool, and this probably won't surprise you, is an X-ray. It gives a really clear picture of the bone, so the doctor can see exactly where and what kind of break you have. Now, for more complicated injuries, especially if a joint is involved, they might order a CT scan to get a more detailed 3D look. And every once in a while, an MRI might be used if they're worried about damage to the stuff around the bone, like ligaments or tendons.
Once that fracture is confirmed, you and your doctor come to the most important decision point. How are we going to treat this thing? Generally, your options are going to fall into two main categories: non-surgical and surgical. So here's how that decision usually breaks down. Non-surgical treatment, like a splint or a cast, is typically the way to go for what are called stable fractures. That's where the bones haven't really shifted out of place. Surgery, on the other hand, is usually necessary for the more serious breaks, if the pieces are displaced, unstable, or if it was an open fracture. In that case, a surgeon will use hardware like pins, plates, and screws to put the bone back together so it can heal correctly. Of course, any treatment is going to have some potential risks. With something like a cast, the most common things people deal with are stiffness from being stuck in one position, and maybe some skin irritation. In rare cases, the bone could shift. With surgery, you might have some irritation from the hardware under your skin or sensitivity around the scar. And while it's not common, more serious risks like infection or nerve injury are things your doctor will definitely talk through with you. All right, you've got your diagnosis, you have your treatment plan. Now we get to the phase everybody wants to know about, the recovery. Let's map out what you can expect while you're healing. Think of this timeline as your guide for the next few months. The first 48 hours are all about getting that hand elevated above your heart to keep the swelling down. You'll have your first follow-up in about a week or two. And here's the really crucial part to understand. The bone itself will probably heal in about 4 to 6 weeks, but regaining a full strength and all your motion, that takes a lot longer, often 2 to 3 months, sometimes even more. Now you have a huge role to play in how well you recover. This is not a passive process at all. You've got to manage your pain, you have to strictly follow the activity restrictions, I mean it, no gripping, no lifting, no pulling. And you have to show up for all your follow-up appointments. But honestly, the most important thing, you have to commit to your physical or occupational therapy. That's the secret sauce that prevents long-term stiffness and gets your hand working properly again. Just like we had red flags for the initial injury, there are some warning signs to watch for during your recovery. If you notice increasing redness or warmth around the area, any drainage or a bad smell from a wound, if you get a fever or chills, any new numbness or tingling,
or severe pain that just isn't getting better with your medication, you need to call your doctor's office. Don't wait.
So after all of that, the injury, the diagnosis, the treatment, the recovery, what's the bottom line? What's the final outlook? Let's finish up with some good news. If there is one number I want you to take away from this for the bone healing itself, it's this one: 4 to 6 weeks. That's the main window of time when your bone is working hard to knit itself back together. Yes, getting your full function back takes longer, but the fundamental healing happens pretty quickly.
And really, this is the main takeaway. It's so reassuring. With the right treatment, and just as importantly, with your commitment to rehab, the vast majority of patients have excellent outcomes. You get back to using your hands normally. The key is just sticking to the plan.
So, as we close out, I'm going to leave you with this question to really think about. Looking back at everything we've just covered, from managing your pain all the way to committing to therapy, what do you think is the single most important step that you can personally take to own your recovery?